So, how are you?
I'm doing okay. I'm a bit on a bit of a hunger strike right now, since the stay-at-home orders have come in.
Oh
Um,
yeah,
yeah, but I'm holding up. Yeah. How about you?
you've been on a hunger strike since then?
Yeah.
Oh no way.
Yeah, I realized
What?
that like pre-lockdown, 1 in 4 children in Ontario go hungry every day. And according to the Daily Bread Food Bank in Toronto, it's now 1 in 3. So instead of spending the groceries on myself, I'm donating the money that I would spend on my groceries to the food bank because it's the children's turn to eat. And I just feel like
Very
that's the right thing to do right now.
wow. That's very admirable.
Thank
Kudos
you.
to you.
Yeah, how are you doing?
I've been better. Just keeping on trying to make sure we get through this thing sooner rather than later. And obviously, no one's happy anywhere. So
Yeah.
just keeping the head up and keeping my eyes. Remember, you lift it up to the mountains. Your help comes from not people, not governments, not social media, and not anyone else, right? So we know where our help comes from, and just resting in that, but also very, 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 very tired of it all. So
Yeah,
that's about where things are at.
I believe that. Yeah.
Yeah. So you wanted to chat, so I'll let you take it away, and then yeah, just try. I mean, you have a very well resourced letter that you sent. I appreciate all the work you put into that, and want to make sure I give you the opportunity to share your thoughts first.
Yeah, so I heard the announcement that there's like the plan was released yesterday. Um and yeah, I just noticed that there was like I'm an older cousin of 16 cousins. I have a lot of little ones. And I'm very concerned that schools are not really being treated as a priority, even though 12 like children's health organizations, including the Pediatric Society, have been urging the government to open schools. And from my perspective, like I take my advice about my heart from my cardiologist. I take my advice from my mental health from my psychiatrist, but I expect the government to kind of take advice on children's health from pediatricians,
Yeah,
and it just
no,
doesn't
and
seem like that's
there is
happening.
work, there is something coming. Just I know it's hard to believe because it's been so long, but
Yeah.
there was some proposals that got shot down just through a number of different things that I can't go into, but
Yeah.
there were proposals that have been brought forward that haven't made it through cabinet, but we're
Okay.
working literally over the weekend on one as well.
Okay.
So hopefully that comes very soon.
Yeah, like I'm just concerned because like I have.
Yeah, but no, for
Yeah.
sure. I was just on calls earlier today about this. Very, very concerned, and it's only getting worse every day, right? So
Yeah.
I would say just post long weekend, stay very tuned.
Okay.
There's a lot of work happening this weekend on a number of fronts, but I would say I can never say that it's 100% until it actually goes through cabinet. So that's why I'm just being cautious. But there is a good proposal that's underway.
And is that proposal to aim to get kids back in school for like the remainder of this year, or is that focused on the
Yes.
fall for this year then?
No, for this year.
Okay, that's good. Yeah, I know
Now,
like
part of the problem, of course, and one of the things that has created, I'm going to say, hesitancy is that last time we opened stuff up, and then the local medical officer started shutting everything down again, right? And
yeah.
that was something that is, frankly, with a lot of this stuff is like we pushed reopening in March way more than they wanted us to, the doctors and the medical teams and everything, and then we saw everything surge and had to lock down again. So there's a lot of hesitancy around going too quickly, and obviously I'm sure yourself and a lot of others, and I understand that sentiment, would want to open up a lot faster and not have that threat of a lockdown. But from our perspective, we're trying to make sure that when we're open for good, and that we're not going back into anything again. So
Yeah.
I get the frustration around it, but we kind of once bitten, twice shy, as they say, and I know that's definitely the case for the premier, because a number of us were really pushing for reopening, and he did listen to us, like, despite what the advice was at the time, and
Yep.
he feels really like that really burnt him when it came to having to go back to a lockdown. So I know it's quite a delayed plan compared to with what people want, but that I think is also part of it. They want to make sure that it's cautious, and once it's out, it's for good. It's not all this back and forth again. So that kind of is the same thing with schools a little bit, where you're like worried that not education so much, but we don't want to see also local medical officers shutting everything down again.
Yeah.
Like they did with Peel and Guelph and Waterloo and anyways, a bunch of places. But
yeah, I think like the thing that kind of concerned me about yesterday's announcement, like I watched the whole thing in like the question period, is that he said like the reason, like Doug Ford said the reason why schools like weren't being opened is because of the huge concern of the 11%. I think it was 11% increase in cases. Yeah, and so like I think but then he went into like the teachers union doing an injunction, and I understand like the teachers union typically doesn't like the Conservative Party. Yeah. I haven't been like around in like the political world very much, but I know that. Yeah, but then like just seeing how religious services are being opened up in outdoors with social distancing, like I'm just a little concerned that like what's the projections of like, since religious services are being opened up outside, what's the projected increase in cases with that? Because to me, like the priority, like as much as I love like going to church and like I'm a Christian, I think like the priority should be with the kids. And I know that the kids kind of benefit from church because some like churches like do like Sunday school and stuff like that and kids programs, and like that's great. But like I hear like every day from like my little cousins, like they call me all the time and I love taking their calls, but like they are very, very distressed at that. So like it just kind of seems like it's more of a political game rather than science at this point, because it just feels like the government's afraid to piss off the teachers union. And I understand like an injunction would just would end up with the government being in court, but I think my response to be with it aren't the kids worth it?
Right. Yeah. No, and I get your point. Yeah, I think some of it, the premier is very off the cuff, also just by nature. So I think he's just being pretty blunt.
Yeah.
But I think that there are multiple factors, and I know on the education front we want to make sure that it's opening soon.
Yeah.
But it's a fair point, and I don't think they have any numbers exactly around outdoor for worship, because we haven't had it where it was just outdoor before.
Yeah.
And they do have numbers around schools, so I think that's part of it. But
okay.
Anyway, stay tuned. There will be some stuff.
Yeah, and I was also just wondering, like you mentioned, like I totally agree. Like when I want the lockdowns lifted, and I want them lifted for good. But like my problem is like once we lift the lockdowns, like we're going to see an increase in cases. But like the things that matter the most are the ICUs and the deaths. Like cases can be asymptomatic people who are not impacted. So it's like I'm just curious as to what the government's doing to have a sustainable approach, because like as much as like I see like vaccines like are great and like they're working and like they're helping like with keeping hospitalizations down and stuff like that, but like I've heard on multiple occasions the premier say vaccine hesitant variants. So my question is like what does what do they mean by that? Like, are they saying that there are certain variants or like strains of of COVID that don't like work with the vaccine? Because that's like kind of my issue.
It's the efficacy, I think. So it's not that it doesn't work. It's because there's always some that come through, right? Like a very, very small percentage. Obviously, substantially smaller than without. And there's some concerns about not Brazil. I'm gonna say
Bosnia?
India and South Africa.
Yeah.
I don't even know what the Bosnia one, but India and South Africa, I think they said. But still, you're talking percentages. Like, okay, so maybe you're 90% instead of 94%.
Yeah.
I don't think it's huge. I don't find it hugely compelling, but I know the premier's he's getting just, I think, very, very wary of having just set expectations too high. So I think he's like worried, and I think he's more on the front of he'd rather, be cautious and then be able to open things up faster than like say, oh, everything's fine, because we did that at the beginning, right? And he's been getting hounded ever since. Like, remember when it first hit and he was like, oh, don't worry, you guys can go and have March break. Like this is, I'm talking 2020.
Yeah.
Right? So I think he really got burned a few times, even with March. And so I think that's really part of it is he's worried about those things, so he doesn't want to be too hunky dory. Everything's fine once we get everybody, as we get vaccinated. Absolutely, that's. I 100% believe the path out based off of what we're seeing in the U.S. and the U.K. and these other places. So I wish we were much more positive about it, but I think he's also just trying to be like, hey guys, like, look, the limitations even there. But I also think those are the things that get played for some reason. Is like he'll make them kind of not offhand comment, but he'll make a comment, and it's like it gets screenshot, it gets turned into a meme on Facebook or on Twitter, it gets turned into a reel on into Instagram, and then everyone shares and it's like, see, Doug doesn't even think that the vaccinations work. Blah, blah, blah. And it's like, no, that's not what he's saying. He's just saying like, look, we have to be more careful about these variants. So I'm a little bit hesitant when people send me things like that I get really riled up about it, because Doug is also one where he'll just say he's very he's very freewheeling. I will put it that way. Okay. But that's my understanding of it, is that there's some of these variants are more hesitant. So that's why they say hesitant. It's like they're not, or resistant. They're not, it's not that it's ineffective. It's just like a, percentage. Yeah, like how effective.
Yeah. Yeah, no, that makes sense. And I was just like, I just kind of want to clear some of that, because I've heard him say that a few times. And yeah, and like I noticed like even with the UK, like they have a higher vaccination rate than we do in Canada, but like they're still facing lockdowns and stuff. So yeah, I guess like as someone who has seen like who has heard like over and over again like 2 weeks to flatten the curve, and we're on month 15. Like when we hear vaccine hesitant variants, that's not really something that is a good thing to hear when you're already skeptical. No,
I don't blame you. I don't blame you at all. No, like it is something that we're really worried about. Like I know he's very worried about it. I'm not as worried, because I think, like, I don't know. I think that there's also the fact that the U.S. I know that they're a little bit different because their ICU capacity is better and stuff like that. But I still think that I'm not as worried about it as a lot of my colleagues are. Maybe I'm naive. Maybe I'm too optimistic. I didn't think anything would happen after we opened in March either. So maybe I'm too much of a believer in just like things will disappear. See, maybe because I keep reminding myself, I'm like, look, pandemics happen. They've happened before. They'll happen again.
Yeah.
Like, and this too shall pass. So maybe I'm too much of an optimist in that. But like, usually the second and third waves, like if you look at pandemics in the past, often the second or third, it's one or the other, is like the worst. The worst, one, right?
Yeah.
Very rarely have you seen a fourth wave be worse, at least from what I've seen.
Yeah, that's what my mom has said, and she's the epidemiologist, so.
Yeah. All right. Yeah. I forgot about that. So yeah, that's I don't know. Maybe there will be some horrific, terrible, bad one that maybe makes us all curl up and turn purple, but
who knows?
I don't think so.
Yeah. I was also wondering, just with the PCR test, because I've my mom and I have both done a lot of research on this, and it is kind of like I've done research, and like it is kind of agreed upon that like the cycle threshold should ever be below 25 and never higher than 35. Dr. Fauci even said that even if you get a 36 cycle threshold, you're just picking up dead nucleotide, and that's like pretty much a direct quote. But then, according to the Journal of Virology, the government of Ontario is operating labs at 38 to 45 cycle thresholds. And on July 30th, the deputy medical officer of health, like Dr. Yaffe, said she said our testing can result in over 50% false positives, and that like that means like that the person doesn't actually have COVID, they have something else, or they have nothing. And like what my mom kind of explained this to me is she's like like what this means is that like the tests are like manipulated by the cycle threshold, which increases the sensitivity of it, so it's picking up more things that might not be COVID, but it's registering it as COVID and as a positive test result. And it just seems like public policy is being based on these tests that are like that have been shown to be have high like false positive rates. And like even Dr. Yeadon, a former chief scientist with Pfizer, said, and I quote, most if not all PCR tests result in false positives due to high cycle thresholds. And I was just wondering, like with this knowledge, like why is the Ontario labs testing at such like high cycle thresholds? And like is public health like recording the cycle threshold of every diagnosed patient or at the time of death, and like why aren't we using more accurate tests like the Sanger test, which has been proven to like have like more accuracy? Yeah, so I'm just a little concerned with like the inaccuracy and just the manipulation of the test, especially when like public policy is based off of case counts rather than like hospitalizations.
Well, no. So I would argue. So there's a few points there. So one, I don't know if they record every single one. I'm also not sure about the Sanger test, but I do know that I've been told in a briefing that this is the most accurate test we have that can be widely available.
Yeah.
Or done, widely, even if it's not perfect. The other part would be that because I've gotten a briefing on the threshold question because I've been asked about it, and they say so at the higher rates. Which I think we're 30 to 35 is my understanding of where under Public Health Ontario guidelines are, is that you're not picking up dead as much as you are picking up earlier. So, for example, let's say Sunday you are in contact with someone who had COVID, okay?
Yep.
Monday they say, oh, I found out I have COVID. You should go get tested. So you go get tested Wednesday. You don't feel bad though, right? Like you have no symptoms yet or anything. If you they pull that swab on Wednesday. If they ran it at 25, they wouldn't be able to tell that you had COVID.
Yeah.
Now, if they run it at 35, because it's earlier in the incubation period and the viral load is much lower, then they can pick up that. Smaller trace amount because that viral load grows until you end up being sick. So let's say you got sick the next week, right? Because it's usually 10 to 14 days later that you're 8 to 14 days that you're starting to get the symptoms.
Yeah.
So they say it's not that it picks up, it's not that it's inaccurate, it's picking it up early so that you can detect it earlier. Because otherwise you came in on the Wednesday, you go home, you're like, I'm fine. You go out and hang out that weekend with people, and then the following Tuesday, so now you're a week and a couple days later, all of a sudden you're sick.
Yeah.
And they say, oh, well, our test didn't pick it up. So that's why they do the higher threshold so that they can pick it up earlier in the incubation period.
But one thing my mom did with research with the new variants is that like people, their viral load is building up earlier than with the original strand of COVID. And like the thing is, it's not like Ontario's operating at 35 cycle thresholds. They're operating at 38 to 45, and it's mainly 40. And that's a significant like increase because like.
Could you send that over to me? Because I've been told that I've been told it was 30, and they moved it up to 35 to do the earlier detection. I hadn't seen the higher.
I'll try to find that study.
I hadn't seen over that.
Yeah, I know it was a release by the Public Health Agency of Canada. And it was also attached to the Journal of Virology. I'll try to find that again. Yeah. But yeah, I just want to like it just kind of seems like if tests are kind of like not following the guidelines, and like even on the box of the PCR test it says this is not a diagnostic tool, like making like public policy off of that just kind of seems a little like irresponsible.
So, one sec. Just gonna send over. Okay, on here somewhere here. So I just sent you one. I'm just trying to figure out here. I just sent you one of the ones that I had here.
Okay.
Anyways, you can read it later.
Cool.
I sent it over to you. I think there's a bunch of work on it, but it's an overview of cycle threshold values and their roles in the PCR test interpretation.
Okay.
So.
Cool. Thank you.
From last fall, but no worries.
Yeah.
Where is it? Sorry. Go ahead.
Yeah, so I think that's like all I have to say on the PCR test. But I was also wondering, like, I've been like both my mom and I have been reading a lot of studies, and it just seems like there's more and more studies coming out saying that lockdowns are not working. Like they're not scientifically proven to work. Like it's kind of like, for example, like just because like B follows A doesn't mean A causes B. Um, and like I just don't. I also haven't seen a cost benefit analysis done, and we're 15 months into this, and we're just seeing so much collateral damage. And like I hate calling it collateral damage because like these are people's lives and stuff. But I was just wondering, like, has there been like a cost benefit analysis done, or like an actual scientific study that like the government is working on showing that it's lockdowns that are working? Because right now it kind of seems like lockdowns are taking like they're like the government's kind of taking just like the victory lap of like, oh yeah, look, we got hospitalizations down, we got like deaths down, but we're ignoring the seasonality of the disease. Like it just seems like it's just so happened as the weather started getting nicer, then stuff went down. And like as we know with like coronaviruses, like they are seasonal. And like I know like Dr. Fauci has said that like yes, like they're higher in the winter and the colder months and stuff. But yeah, so like it just doesn't seem like there's like many studies coming out that are saying that lockdowns work, and it just seems like there's more and more studies coming out that saying they aren't work, like from Stanford and like from a bunch of children's hospitals, and there's one in Alberta. So yeah, Stanford. I think Yale also came out with one saying they don't work and they actually don't really make much of a difference. So I was just wondering if like what data and studies is Ontario using to prove that these measures are necessary? Because in order to break the Constitution, you have to prove that what you're doing is necessary, and that it doesn't cause more harm than good. And it doesn't seem like either one of those benchmarks has been made to break these constitutional laws.
Yeah, so there are I can send over to you. I just sent you actually a whole bunch of studies
Okay.
with regards to lockdowns because I've done a fair amount of my
Yeah.
own research on this. I'll just like believe me, I don't just defend things mindlessly. I
Yeah.
really take my time and make sure I know that I'm actually in good conscience doing so because I'm also a Christian and need to be able to look myself in the mirror and my Maker in the not in the eye, but you know what I mean. Like I have to give an account as well, right? At the end of the day. So there's. I'm going to send you actually. I know everyone kind of rolls their eyes at Public Health Ontario things, but I think it's important to perhaps look at the. So there's about 70 or 80 studies I think that they have included. Okay, 85 studies included in the reference of their overview.
Okay.
So it's an environmental scan of lockdowns. And their efficacy, and so I just sent it to you as well. But
okay.
If you look at the studies, I've probably only gone to 30 or 40 of them, and at a certain point, I was like, okay, well, it's all the same thing.
Yeah.
Right?
Yeah, you can only read so many studies.
And looked at the methodology. Pardon?
You can only read so many studies without a headache.
Honestly, it's so true. It's so true. Like, I have a pounding headache literally as we speak because it's like everyone since yesterday has obviously just been crazy. But
yeah.
That's like one of those things where it sounds weird, but I really actually usually enjoy it. But the problem is like there's just so many, and ironically, I'm still at Mac part time myself, so I'm like trying to do my own courses in the middle of all of this.
Yeah, I feel that.
Interesting. Yeah, exactly. You're in a similar boat, but anyway, so I sent that over to you. Just scroll down. It's a little farther down in there, but I'm happy to if you have concerns with their methodology or anything.
Yeah.
Part of the problem, like here's the problem, right? So I don't think there's been a full CBA because I don't think that they have all the data yet on it, right? So it's really hard to make a predictive CBA. I don't know, maybe an actuary could. I think we should have.
So I feel like there is a lot of data out right now. Like there's like
compared to where there was. The problem becomes is you have a lot of it is what ifs, right?
Yeah.
So if you say, okay, well here was this cost, and they say, yeah, but if we hadn't done it, you can't prove that a lot of those suicides actually haven't really gone up, but okay, let's say substance abuse and childhood eating disorders, right?
Yeah.
So a lot of it becomes, well, you can't prove that if we hadn't, that these would not have happened.
Mm-hmm.
And it becomes like a classic one where it's like, okay, but it kind of goes both ways, right? So it becomes a bit of he said, she said. You say, okay, so lockdowns you could say, well, you never tried not locking down, so you can't prove that lockdowns are what saved those people's lives. So we had 12.8% surplus deaths last year, right?
Yeah.
And I would argue a significant portion of those are from COVID and related issues. Well, you could argue, well, that's a higher number than it would have been without lockdowns. Without lockdowns, that number would have been 7%, let's just say.
Yeah.
But I could also argue, well, that number would have been 30% because of all, it would have been a surge, and then no one else would have been able to access care because everyone would be in the hospital. And it becomes like this is the fundamental issue is you have to, at a certain point as a government, pick a lane. You have to say, okay, we're going to listen to these people. We might not agree with 100%, and we push back on some things, right?
Yep.
And you have to weigh that too. But the premier, I kind of use the example, and it's a flawed example, so please don't read too much into it. But you have the CEO of a corporation, and he has a tax advisor. Now, the premier is the CEO. The chief medical officer is the tax advisor. The premier can say, look, I want to file taxes this way. And his tax advisor can say, you shouldn't file taxes that way. I'm an accountant. I've spent my whole life working on taxes. I know how taxes work. I've talked to lots of other tax people, and they say you should not file taxes this way. It is A, illegal, it's B, bad, C, it's not. And the premier can say, well, you're wrong. I'm the CEO. I'm overriding you, and we're going to file our taxes this way of the firm, right? But he has a trust for the expertise of his accountant.
Yeah.
And so, again, it breaks down under, too many, if you start, like every example, when you start tearing it apart. But the point is, like, the premier trusts Dr. Williams and the advisors. Yeah. And even if he doesn't love all the things that they're doing, which he doesn't love all the advice. I know that for a fact. I see it in caucus. He still is like, look, I trust them. They got us through the first wave. We're getting through this. We're coming out the other side. He's not going to, abandon ship after 15 months and be like, yeah, sorry, we listened to you guys for this long, but now we're just going to throw it all out. It's not going to happen. Yeah.
And, I think, my argument to that is just, Toronto has been in lockdown since, I think November. And, I don't see that. It didn't work, that didn't work for them.
But no, because they would argue it did work. They would argue the cases without it would be that much drastically higher. And then it becomes you saying, well, no, it didn't, and them saying, yes, it did.
Okay, but they were locked down for, months.
But they were never, so their argument would be, they didn't, here's the irony, right? So they wanted a Melbourne style lockdown.
Yep.
All these people complained that we didn't lock down hard enough.
Yep.
Right? And so that's why Toronto still had those cases.
Because of what?
Okay, well, those cases, that's why they had the cases that they had.
So because we didn't lock down enough?
Yeah.
Okay.
So our argument would be, look, there's still some cases, but because we still allowed, curbside, there were still interactions outside, people went outside, people did this, people did that, was it 100% lockdown?
No.
And so then it becomes an argument, okay, well, should you lock everything 100% down or not?
Yeah. But the data suggests,
think you should, but
yeah. Oh, I agree, and I think, but the data suggests that the business, especially when I'm in particular with business, all the businesses that were shut down don't even make up 1% of outbreaks, even when they were open, and also the World Health Organization and the CDC has confirmed that outdoor transmission is virtually impossible. It's not impossible, but it's incredibly rare, and so is asymptomatic spread. So, as much as people want to, say, oh, we should have locked down hard enough, and that's the reason why, and if we're using, oh, people are still meeting outside, it doesn't void the studies that were done about outdoor spread and asymptomatic spread.
Right.
Yeah.
Yeah, no, and then, but there's also those who argue that it might not just be, it's not necessarily asymptomatic, there's also just the aspects of people still going out and not listening, right?
Yeah.
So then that's a reason why, where ironically I get it from both sides. People saying, "Oh, the lockdowns don't do anything because no one's listening anyways, because I'm not listening."
Yeah.
And then the other side is the lockdowns aren't working enough because you're letting people just disobey. So it's you're kind of darned if you do and you're darned if you don't.
Oh, I totally get it. You're from like yeah, having to take it from both sides. So like yeah, I totally get that. But yeah, I don't know. It just kind of seems like, and I understand like picking a lane, but like it's been 15 months, and it just seems like with all the excess deaths that Stats Canada released, and they suggested that a lot of those were due to like the consequences of lockdowns, like the unintentional consequences. Like
Right.
yeah, like it just seems like I totally agree with picking a lane, but at what point are you going? Are you just going to follow your lane off a bridge? And it just seems like Ontario is kind of doing that because like Doug Ford brags about being the most locked down like jurisdiction in all of North America, and I personally don't think that's something to brag about. Like I think that's kind of embarrassing. Like as yeah, I know like yeah like I'm like as much as like I want to respect like public health, it's also not their right to tell me what is essential for my health. And it's also not
Right.
right for them to tell my 12-year-old cousin who's suicidal what he can and cannot do to stay alive. And that's where
Yeah.
like I personally
Yeah.
really
I
like
would
am
agree that I
practicing
don't.
social like civil disobedience because I see these lockdowns as harming. Like I've seen the firsthand account on the people I work with, my cousins, like my friends and my family, and that's why I practice social like a civil disobedience. Like obviously like in safe ways in the sense where like I'm not going to mass gatherings. Like I'm not like I'm being very selective of who I'm seeing. But like as far as I'm concerned, the stay-at-home order didn't change anything I'm doing.
Right.
Yeah.
Well, I'm sure it did. Like, you can't go to the restaurant. You can't go to
Yeah.
church.
But other than that, like nothing really changed. Like I'm still seeing like a select few people. I'm still if my cousins need me, I'm there, and a
Yeah.
public health officer isn't going to stop that. Like
No,
a
and
police
that's
officer isn't
look,
going to stop that.
and I respect that. That's a personal, conscience decision about what leads to civil disobedience and what doesn't. I can't obviously
Yeah.
say anything about that, but I'm talking broad spectrum. We
Yeah.
do have good evidence to show that reducing mobility reduces through lockdown, reduces community transmission, reduces infections, reduces the amount of admissions, and reduces the amount of deaths. But on the other argument, which is the one you make, I think there are huge costs associated with it, and those can't be ignored.
Yeah.
And I would say the challenge as a government too is you do get very much ripped both ways in the sense that
Oh yeah.
you remember in March again, so we were reopening. People were saying we were opening too fast. We're opening too fast. We were like, no, we got to get through this. We got to push open. Started, there was all this stuff that was going to open up, and boom, the cases started going up to 4,000, 5,000, and it was like one lockdown, and then it like got strengthened. Then it was like the enhanced strengthened lockdown, and then it was like the enforced enhanced strengthened lockdown. I was like,
yeah,
ridiculous. It was silly, but it doesn't change the fact that I think has had a huge impact on the Premier's cautiousness now.
Yep.
Because he did essentially tell them, like, look, I know you guys don't want it, but we're going to go ahead. And they're like, well, if you do, then everything's going to kick up again.
Yeah.
And he's like, I don't think they will, and Caucus 2 was very, very heavy pushing.
Mm-hmm.
And we're all kind of sitting there going, like, okay, we don't like it, but we did, like, he kicked the can for us, and the can backfired.
Yeah.
And I know that's hard to hear because it sounds cynical, but it is a fact that he listened to us even though he didn't want to. Even though Dr. Williams, I was advising against it, he was like, all right, if you're gonna do it, you're gonna do it, and then we all kind of got, I would argue, screwed over as a result. So
yeah, but like my thing is like with all the public health modeling, like I understand, like, and like the thing is like with lockdowns, like there's like the less restrictive lockdowns and the more restrictive lockdowns, and like it's a spectrum. So with like all the studies that like support like whether they do like whether like less restrictive lockdowns and more restrictive lockdowns work, like there is a spectrum, and I'd say Ontario is like close to the more restrictive, not like all the way, but
right.
Yeah.
But getting there.
Yeah, but definitely getting there. And what was I gonna say? Yeah. I just don't like I just don't understand why, like when if we knew all like if we saw these projections, why we didn't prepare like from a medical standpoint, like why didn't we build like I think you mentioned like hospitals like in Niagara Hospital ICU capacity or hospital capacity was like 170% or something like that.
It was 206% at one point, and now it's down to I think under 150.
Okay.
So it's getting there. It's getting here. I'll send you a screenshot because I had people really not believing me on this one. So where is it? One sec. So I texted Linguario. She's the CEO of Niagara Health Sciences.
Okay.
Or Niagara Health Systems. And I just sent you the screenshot there. So she's like, yeah, we had a 200% occupancy. So anyways, yes.
Yeah. So I was just like, I'm just a little alarmed. Like we knew all this was going to happen. And like, I'm very much like, I think it's just as important to protect elderly lives as it is to protect children's lives. Like, I'm not saying like screw the old people because that's wrong, and like that's not a Christ-like approach to this at all.
But I also think that that's one of the things I know is I don't know why, but it's controversial. Look at how effective the vaccines have been in long-term care.
Yeah.
Look at them; they're remarkable. Like they have reduced deaths astronomically, and that's where I think that is where we're going to end up this fall. It's not going to be that we have no cases. It's that those cases don't end up getting into the hospital. And that's fine.
Yeah.
Like you can have COVID all day long, and as long as you're not taking, like, this sounds so crass, but like if you have COVID and you have the sniffles and you're not feeling 100% and you are like, I'm just going to call it sick day.
Yeah, that's fine.
But because you're back, that's fine. We don't care. We don't want you, and this sounds really, like, again, I'm saying a little abrasively, but we don't want you going to the hospital.
Yeah.
And then ending up there, not even just for you, because that's also part of it, but also because we don't want you to be in the ICU and then a multi-car collision happens and all of a sudden we're like, sorry.
Yeah. No. I'm just concerned that like why wasn't there like pop-up, because we've seen like pop-up hospitals happen. We know it's possible, and like I know I've heard from a number of like ICU nurses who are out of work and ICU doctors who are out of work. So it feels like we have the people. It doesn't feel like we knew, like, again, with knowing we were going to have a surge in hospitalizations, no medical like approaches happen. It's just like lockdown. And like to me, it's like, okay, if you want to argue lockdowns work, but it's like, what about the people? Like lockdowns aren't going to save someone who's already in the ICU. You know?
Right.
So like my question is like, why wasn't there like more preparation for that? If we knew this was going to come, we knew there was going to be a second wave, we knew there was going to be a third wave. So like, why didn't we prepare better for this?
It's a good question. I think part of it was, so some of it was we did, right? So we expanded capacity, I think 24%, but the problem was we couldn't get enough staff even for that. That was one of the challenges.
Yeah.
So I would argue that it wasn't like we just sat there and were like twiddling our thumbs. Yeah. But I will say, looking back at last August, we were definitely in a state of the worst is past. We're reopening. Like I remember advocating, we were working on like 50% churches. We were like, everyone, once we get schools open in September, we'll be fine. Like we were down to 60, 70 cases a day.
Yeah.
Right? At the end of August, even the beginning of September, cases were, I'm going to say, around there. They weren't high. They weren't over a couple hundred at least.
Yeah.
A day in the whole province. And then essentially what happened is it stabilized, and once it started creeping up. But looking back, there's things we should have done differently. Looking back, there was this sense of, not amongst health, but even amongst colleagues, like they wanted us to lock down in October, remember?
Yeah.
The health people. And we really, really held off until it was at the point in December, right before Christmas, where it was like getting really bad and we had to. Do I think we could have done some things differently? Yeah, but I don't buy that we didn't do anything. But I also, it's easy with hindsight 2020 to be like, oh, we should have known that was going to be that much worse. Yeah, we're right. Like we should have, because obviously second and third waves happen. But there was just kind of this disbelief, like it was. I don't know how to describe it, but I know I had it where I was like, okay, things are not going to get. They're like, okay, we're going to hit 2,000 cases a day by this time. I'm like, yeah, whatever. We're at like 60.
Yeah.
Right? We hit 2,000. They're saying we're going to hit 4,000. I'm like, nah, I think we peaked. And then we hit 4,000. And it's like, you're almost 5,000. And I mean, we didn't go that much higher than that because but I know for myself, it always felt like it wasn't going to happen, and then it did.
Yeah.
Or, we're going to hit 300 people in ICU, so they have to start canceling surgeries at 150. So we're going to hit 300 people in ICU. I'm like, whatever. We have 45 people in ICU. We'll be fine. Yeah. So you hit 200, all of a sudden you hit 300. We're going to hit 600 people in ICU. Whatever. You're going to double again. All of a sudden we were at over 900 in this go around, right?
Yeah.
So I get it, but I also have it where I have it myself personally, where it's like I always feel like it's not going to happen, and then when it does, it's like by the time it does. Yeah, I've been grateful that frankly I was wrong on some of this stuff, because I was dead ticked when we shut things back down again in the beginning of April. I was livid. I was so mad and fighting it. But looking back, I think it would have been a lot scary if we hadn't, and everything had just gone out of control compared to the fact that we did, and I think kept things lower than they would have gone otherwise. And I know you're probably not going to agree with me on that, but for myself.
I just think, like, along with lockdowns, even without lockdowns, like, we need to expand healthcare. Like, healthcare has been overwhelmed. Like, I'm looking at, like, a graph since 2017 through 2020. Like, it was ICU capacity in Toronto was at 86% in 2017, and in 2020 it was 80%. So, like, ICU has been a problem for a long time. Long-term care has been an issue since my grandma worked there, like, 40 years ago. So, like, it just seems like this is kind of, like, we're just seeing, like, the problems that have existed for decades, but it doesn't feel like we're doing enough to do that. But, yeah, like, I totally get what you're saying, but, yeah. One more thing is I was also curious. I know a few months ago, Roman Baber, he put a motion in House called the "We Are All in This Together" Act, and I was just wondering if you supported that.
No, I did not. I wasn't there.
Okay.
But if I had been there, I wouldn't have. Partially because it's legislative. Like, it was a motion, right? Because it can't. Like, so he was trying to be too cute by half. Partially, that's the one reason, and this is going to sound very cynical and personal. Please don't take this as that way. But he whined when he was in caucus with me, and I respect him. He's a smart guy. He's doing his thing. But he whined and complained about how he left a $400,000, $500,000 a year job to come and be an MPP, and nobody was respecting him enough. And he always talked about how much he used to make before politics, and how it was ridiculous that Mike Harris got rid of our pensions and all this sort of stuff. So I didn't have a lot of respect for him going out there after having been always whining about that and acting like, they just don't care, because he knows full well. Like, it was smart politics, don't get me wrong.
Yeah.
Because got a lot of coverage, smart on him. Like that, but it was cynical and political. Because it doesn't do anything. Either of the motions, the response motion, I thought was petty. I thought it was dumb to be like, oh, now we're going to bring a motion cutting your pay if you want to do that. But I also don't have a lot of time for that kind of stuff. The same thing with, like, the NDP motion on Monday. Great, you're bringing forward a motion when you know full well it's orders in council that make those changes. It's not motions. Yeah. You know there's changes coming very soon. Like, cabinet was meeting on Wednesday to make some of these moves, right? That tomorrow are coming into effect. It's like, great, now they're just doing it to divide myself and my team, because they know it makes it really difficult for us in our ridings. Which, that's fine, that's politics. It is what it is. But I also don't have a lot of time for that. Personally, it irritates me. So, yeah, I did vote. I wasn't there, but I would have voted against it.
I just kind of want to challenge that, because, like, and I get what you're saying. Like, yeah, like, it was like a political, like, move, in what. And yeah, but, like, I feel like if like MLAs, or sorry, like, MPPs, like, if they actually, like, understood what it's like to live on CERB, I feel like there'd be a lot more empathy towards people who are. Like, I'm not living on CERB. Like, I'm still employed. Yeah. But, like, personally, I would, if I were, like, I would love to have my paycheck cut so I can actually understand what people are going through. Because same thing what I'm doing with my hunger strike right now, because I realize, like, I'm very fortunate in this. But at the same time, like, I feel like I know the Stephen Harper government, when, like, I don't remember a lot from when he was in like in office because I was young, but I remember like he paused like the automatic raise for
Yep.
MPs during the 2008-9 recession
Yep.
to show solidarity with Canadians. And as
Yeah.
much as like you might question like Roman Baber's like intentions and like I don't know them, I'm not gonna pretend I know them, but like the thing in itself would have actually showed solidarity with other Ontarians and actually show that the government actually kind of like understood what they were going through, and that money could have been used to improve healthcare. So I was just wondering, like,
Yeah. So
and from a
Rebecca,
Christian perspective, like I just see that like in a sense of incarnational like theology of like Jesus coming to us and living the life we did. So I'm just
So
wondering like why.
I'm gonna push back on a few of those points. So first point, and I'm 6 minutes late for another call, so I'm gonna have to go soon. So
No worries.
first point, and I've never said this publicly, so don't take it as like me trying to be like, oh, look at me.
Yeah.
I lived for a year in Ottawa on $1,407 a month.
Mm-hmm.
That was my income.
Yep.
Pre being elected. So I've lived on less than the CERB.
Yep.
So that's the one point. Believe me, I'm not doing it for the money. I could have done a lot of other things. So second point, you're talking about Harper freezing it in 2008.
Yeah.
They froze it in 2008 in Ontario, and it's still frozen. So it's been 13 years. The federal government, so the way it's supposed to work, and I'm not saying this like, oh, woe to us or anything, it's just good for you to perhaps know. So the federal government, the way it works is MPPs are supposed to get 75% of what an MP gets.
Yep.
But that got lifted in like 2011, 2012 with Harper, and it still has been frozen. It's frozen until the budget is balanced.
Okay.
Which will be a long.
Oh, it'll be a long time.
So I highly doubt in my life we will see a raise. But I'm just saying that like it's been frozen for 13 years. It hasn't. It's not like MPPs are getting automatic 2% increases every year. It's been frozen at what it was then.
Yeah.
Then. So I'm not saying like, oh, that's terrible or anything like woe to us. I'm not. I'm just.
Yeah.
It's good context because everyone thinks we're getting the same wage increases that the feds are, and that's not the case.
Yeah.
So that's the one part. Secondly, I take a little bit of umbrage when people play this game on like, oh, if you actually cared, you'd cut your salary. No offense, but you don't know what I give.
Yeah. No, right? I get that. Yeah.
Yeah. And then the last thing is going back to the virtue signaling thing. Sure. Okay. I get it. Like every dollar counts. Every dollar counts.
Yep.
So you cut all the MPP's wages. What does that actually do? So you have a few $100,000 extra to put into healthcare out of a budget of $67 billion.
Yeah.
Right. So you can pay one more doctor. That's great. That's great.
Or it could go to families and food banks.
Sure. Okay. It could go to anything. Right. I don't really care which. Like you mentioned healthcare. That type of stuff. I get the appeal of it, but it doesn't actually do anything to address the issue that is being raised. Now, I'm not saying we should get raises, and I'm not even saying that. Yeah. Oh wow, like we're not getting enough. I'm completely content. I'm not doing it for the money, and I do give because I believe that, like you said, I'm called to as someone who lives Christ's life. But I took a bit of umbrage with that, and I hope you kind of understand why now.
Yep. No, I get that. It just kind of seems again like showing solidarity with the people that like the government is forcing out of work.
Right.
Yeah. But I do respect like your opinion and everything, and I do respect like I believe you when you say like you give and like that's your business, Yeah. So yeah. But yeah, I get you're late for a call, but thank you so much for your time. I appreciate it.
No, thank you. I appreciate. Listen, I have a lot of respect for you on the work that you're doing and the fact that you're really well researched. I find I have a lot of time for people like yourself as opposed to the amount of people who say do your own research and you'll figure it out. And I'm like, I do my own research, and I don't agree with you because here's my research, and they don't even read my research. They just say I'm wrong.
Yeah, no, I'll definitely have a look at it.
They haven't done their own research. Like often I get these people who send me all this stuff. Well, they don't send me stuff. They send me some Czechoslovakian person on YouTube, and they're like, it's an ophthalmologist. He says that vaccines are bad, and I'm like,
oh boy,
I don't even know what to do now. You're not like that. You always have very well rationed out information. So appreciate that, and have a good day.
Yeah, you too. Bye.